I'd like to invite the chair of the next panel, panel 2, Professor Srinath Reddy, to kindly come to the dais.
Good afternoon. I'm sorry we've not been provided an opportunity for 5 minutes of physical activity or bio break, but those who are quite keen on utilizing the facilities may do so, but we'll get started in any case. I think the last session has been quite remarkable. Initially, it started off in the opening session and as well as in the early part of the panel discussion by defining the content and context of health policy and systems research. It showed not only the interdisciplinarity of the scientific strength that underlies this research discipline, but also outlined the fundamental philosophical foundations which emphasize social justice and espoused equity as one of the principles. But it also moved into the operational imperatives of not only providing a problem diagnostic, but also providing solutions which are implementable and ready for application in the health system. And I think in this particular panel, we are actually being challenged, to use a colloquial expression, to show where the rubber hits the road, of showing that we are really relevant and useful in terms of enabling universal health coverage not only to be defined as a concept, but to be implemented as an operational reality. And towards the end of the last panel, there were some questions on what universal health coverage actually means. And of course, there are different terminologies that are floating around, whether it's national health insurance or national health assurance or universal health coverage, whether it's going to be a targeted program or a totally universal program, and whether it's going to be progressive universalization. As Nada said, indeed, that it's difficult to fill the entire WHO cube all at once. So one has to choose how to operate in each of those dimensions and how to progressively implement universal health coverage. But some of the guiding principles which are very clear are access, equity, efficiency, and quality. And we now have to really define as to how HPSR, in order to prove its practical value to the policymakers and health system managers, can enable them to implement universal health coverage, where the researchers who are involved in HPSR should not be seen merely as ivory tower researchers or armchair critics, but as able and willing allies of both the policymakers and the program managers.